out of school. This we have seen has got significant consequences, not only in learning, but in other aspects of child development. It's therefore very fitting that we have got this theme for the World Children's Day today, reimagining the future of learning. Why would we want to reimagine the future of learning? Why do we not just say, let's go back to what it was before? History has shown that in times of crisis, as a society, we have got two options. Actually, I can say three options. One option is to freeze and to do nothing when you have a crisis. The other option is to hope to go back to business as usual. But there's a third and a more exciting option that I may pose for all of us. That when there's a crisis, we also have the option of reimagining the future. And imagining the future which is much better, so that we change the trajectory of what it would have been to a new trajectory that the crisis provides us. History has shown that people who take advantage of a crisis bounce back better. They are able to build a better system. This is the opportunity. Much as we face this crisis, the human crisis that has been thrown upon us, how do we take the advantage and say, some of the things that we would not have been able to do, how can we be able to take care of them? And we say, we reimagine the future of learning. And our COVID-19 Reimagine campaign, UNICEF calls upon government, partners, and businesses to imagine a Uganda where all the rights of the children are fulfilled despite the crisis. Building a better post-pandemic world will be a first step towards making the imagination a reality. It calls on children, the young people, our future, to really imagine. Society shows that the people who really can do a lot of imaginations, who are not inhibited by their past, are you children. Help us imagine. Help us create this dream of where the world comes in, where the world could be. And this is what the World Children's Day in the year 2020 is all about. This pandemic has thrown us into some thought process that some things we have to think about. We have seen the deep inequalities in our societies, where some children are left behind as compared to others. We have seen where some children have been able to move and to be able to access digital learning. There are many children who are not even able to get textbooks. These are disparities that we have to address in case we want to reimagine the future of learning. Can we imagine a future where there are no disparities? Imagine as children pay the heaviest price as inequalities in learning widen. Many young people, including yourselves, most likely will not be able to access the mobile networks, the internet, the radio, newspaper for remote learning. We know that. But these are the future of technology where the world is moving on. If you look at learning in many countries, people are moving away from paper to using internet learning, to using radio learning. How do we make sure that no child is left behind? I wish to congratulate the government of Uganda for its bold step in prioritizing the reopening of schools for candidates' classes. Nelly, you're one of them in class 7. I know the government has taken all possible measures to be able to do so that you're able to go back to school safely. So I really want to acknowledge that. I also wish to thank the private sector for their valuable contribution to the COVID-19 response. While schools are from learning to earning so that you can start earning your livelihood. Tell us your dreams. Ask us questions. Give us your solutions. Amplify your voices. Speak out so that we can be able to imagine with you, so that we can go with you, we can travel with you as you imagine your future. This is very important because history shows that it's children where we're able to learn most, where we're able to leave behind our baggage, because children are able to imagine things, while adults, already we have got a lot of history that in some way or another does not allow us that flexibility. That leads us to some of the questions. When you want to imagine, what is the biggest question that helps you to imagine? And I'm told that question is, what if? You know, imagination is really getting rid of the boundaries that are surrounding you. What if we were not afraid and we were to seize this opportunity to imagine? What if we were to imagine new ways of learning? What if you didn't have to follow the old life and you are free to imagine a new life? What if we finally bridge the digital divide and we have the Ugandan child able to access world-class digital learning available to any child in the world? What if? What if there was no marginalization and every child in Uganda was given the same opportunity so that they could be able to access quality education, not because of their social status, not because of their location where they were born, but only because of their ability? What if? It can be done. And you can, if we all come together and we're all determined, we can do it. Let me share 3 areas or 4 areas that can propose as we try to imagine these what ifs. We try to imagine what is possible. First is to modernize education. We must build the foundational, job-specific, and entrepreneurial skills that young people need for work, including digital skills. Very important to modernize education. Secondly, we need individualized content and digital platforms, learning that is tailored to the child, not child who has to be tailored to the learning to be tailored to each child, including those with disabilities, including those in difficult settings like refugee settlements, providing what they need and want to learn in language that they understand. Thirdly, we need to reach every child wherever they are. That means we need to come up with different solutions, maintaining low-tech and no-tech options, even as we scale up our digital learning options. And finally, we need to build up on the leadership that's already there from government and from other stakeholders so that we can unlock the we can unlock the potential of every child. UNICEF is now working with the public and private sector partners worldwide to address the disruption of education and achieve this ambitious vision. Join us in asking, what if? And let's play our part in making the what if a reality. Thank you so much, ladies and gentlemen, for listening to me.
Thank you very much. Thank you very much, Shadrach. Thank you very much for helping us really get to know where we have come from and what is really facing us. There have been 3 big issues here that you need to note. When you are faced with the pandemic, our children are now here. Should we freeze and completely do nothing? Should we live in the world of hope? Or should we reimagine the future? But the most important thing is thinking of how to move forward, reimagine the future. I've liked the options you have given. It has really been catching, and we all see that we have potential to do something and ensure that we have quality education with us. We have not lost hope completely. We are sure that learning will take place and we shall get to where we are supposed to be. Ladies and gentlemen, we have got a team of panelists here with us. They have all listened to what Shadrach has really. The paper has been very enriching. It tells us where we are coming from. But we also need to think of where we want to be. I have a team that is going to ably talk about topics that contribute towards the reimagining of the future of learning. And as I introduce them, I've got 6 panelists, but I'll give each of them a chance to come and say something, and then about the topic that they have on their table. We shall start with Dr. Lusambu Mukasa. Dr. Lusambu, we want you to come and tell us, the impact of COVID-19 pandemic on the education and learning in Uganda. Do you think COVID has had challenges? Has it given us opportunities? Should we stay with the status quo? Or as education, you have planned something to better up issues? Dr. Lusambu?
Thank you very much, Abe. For sure, just like Shadrach has shared with us, COVID has created a number of challenges. These challenges, actually, if not all, are likely to cause a revolution. And there shall be a lot of paradigm shifts in the education system. First and foremost, the sitting down of learners for 8 months now is not a simple thing. Think about their discipline, think about their behavior, think about their psychosocial issues. I think the children have gone through a lot. Think about the teachers whose job was to teach, but for 8 months there is nobody to teach. These are all challenges, and these challenges are definitely bound to cause a lot of paradigm shift in the education system. And I am also saying COVID is not going away tomorrow. Nobody knew when it would come, and therefore nobody knows when it is to go. That's why issues like the new normal, like issues like the SOPs, are likely to be with us, and the better, the earlier we get used to them, the better for the future of our children. And we should also inculcate into the children a way of living with COVID for quite some time. Because definitely these are issues that have to stay with us for some time. How do we relate the source to the living and lives of children and the learning of our children? And I'd like to applaud the government, which said, no, let us reopen the schools. Because again, you cannot say learning shall stop forever. When we have children, learning must happen. Because learning is a continuous process from the day we are born to the day we die. So the question is quite wide, but to answer it in summary is to say there are many issues that have come into play, majority of which are challenges. There are opportunities as well. Let me turn to the opportunities. We have always talked about the ideas of thinking within the box, thinking outside the box. Today, I am sharing with you viewers that let us think without the box. We deserve to think without the box if we are to cope with COVID, especially in the learning circles. This is the time our teachers have to think, to critically think of how best we can achieve learning of our children. COVID has removed the box. If one thought of teaching in a classroom of 4 walls, this is the time to think otherwise. Because COVID has removed the box, COVID has removed the walls. We are saying, for example, now that learning is continuous. Learning is taking place. But there are no classrooms. There are no teachers. We are just providing learning materials. We are calling upon people to learn, children to learn on TV, to learn on radio, but the classrooms are not there. So thinking without the box. If one thought that for a child to learn, a child required a teacher, this is the time to think otherwise. Learning can take place without the teacher as long as materials are there, as long as the radio is there, as long as the television is there. These are some of the advantages. We have also been talking about the 21st century and the critical skills of the 21st century. The critical thinking, the creativity, the communication, the collaboration and cooperation. This is the time to put all these into practice. How can we use the technology, that is the communication? How can we use the technology to effect learning? How can we use the critical thinking to effect learning? How can we use the collaboration to ensure that what is happening in Kenya can help what is happening in Uganda? Can we collaborate? Just like Shadrach was sharing with us, these are not issues for only Uganda, these are issues for the entire world. That calls for a lot of cooperation, a lot of collaboration, a lot of communication. These are the 21st century skills which we must really concentrate on if learning is to continue for our children. Another important thing to think about during this period is to realize that we need to adjust a lot, and flexibility must be at play. For us to think that things are likely to happen the way they used to happen, as it were, and there shall be world without end, must stop. And it goes back to thinking without the box. So, ladies and gentlemen, learning is really possible to continue, and learning shall have to continue, but under a different paradigm, a different shift. The revolution has come, and everybody should welcome the revolution. Flexibility, creativity, innovation must be at play by all our teachers. And the teachers need also to reflect on the psychosocial a lot within this period. They have experienced. So as they come back to teach the learners, they must think about all this. They must also think about the learner, because we have disruptions that have affected our learners. The learners that left school in March are not the same learners coming back to school today. They have gone through a lot. Some of them will come back to school richer than their teachers because they have been trading into charcoal and so on. How is the teacher ready to handle such a learner? Some of our learners are coming back to class pregnant. We need to know how to handle them, and we can't afford to keep them out because they are pregnant. It's none of their fault. It is what has happened, and we must definitely be ready to embrace it. Some of them have tested drugs, and they are coming back with all these experiences. We need to be ready to handle our learners and be able to see how best we can bring back the best out of our children so that they can learn and thrive. Because we must always remember that our children, our future, and our future, our children.
Thank you very much, Dr. Lusambo. I like that slogan because it represents the child. Our children, our future, and our future, our children. You have hinted about quite a number of issues, but most notable is that we need to be flexible. After the challenge, we need to be flexible. We need to be creative. We need to be innovative. You have hinted about the challenges that the children are coming back. Some learners have become pregnant. We are hearing this and we have seen the statistics. And some of them have tested drugs, just as you have alluded. This one gives me a chance to now bring in the child and tell us. These are children that are at school and they're experiencing the situation the way it is. My daughter Belly, you have been at school. You are representing quite a number of other children that are out there. And we want to know, as children, what has been your experience since the coronavirus set up in the country? How have you seen? You are representing other children, but particularly you and the ones that you are representing. What is the experience? Share with us. Thank you, Betty. Welcome. You can sit and talk.
Thank you very much. My name is Gasha Isabella Neri. 14 years old.
Oh, thank you. You can come here. Come.
Thank you very much. My name is Gashaija Bella Neli. I'm 14 years old and I'm from Nachivo Primary School. I'm in Primary 7. I take this opportunity to thank the organizers of World Children is Day, UNICEF, TMF, Government of Uganda, more especially the Minister and the Ministry of Education and Sports. Thank you very much. I'm going to share my experience on how I continued learning during the COVID-19 pandemic. We had just reported back to school, but within a short time, we heard that there was a pandemic which had broken out in the world, beginning from China, and that was none other than COVID-19. On 18th March this year, the President of Uganda announced that all schools should be closed on 20th March this year. So we had to go back home unprepared. But before leaving school, we were given homework papers to do, though the work was not much, because we all thought that it would be for a short time, but it wasn't really what we thought. I went back home and I did my work, but I had a thought of taking the work back to school for marking, but there was a total lockdown. I wasn't able to move and take the work for marking. Shortly, the president addressed and added more 21 days. I started asking myself, what am I going to do? 21 days, and there was no hope for education sector. But I decided to get my books and revise. And the good thing, the Minister of Education and Sports introduced TV and radio lessons, which helped me a lot. I take this opportunity to thank the Minister and the Ministry of Education for that initiative. However, I could face some challenges. My siblings were more interested in watching cartoons, so whenever I could change to watch Book a Day, BBS Terrifiner, to go up with the lessons, we had that misunderstanding with my siblings. And the way of communicating to the teachers who were teaching, I wasn't able. My parents could go at work, so the way of communicating to the teachers who were teaching so that I ask them questions, I wasn't able. Besides that, I also thank Bukede newspapers for providing us past PLE. It had a lot of questions which kept me busy instead of loitering around in that pandemic. And the good thing with that newspaper, I was doing the work, expecting that the next day they are going to bring the papers, the past PLE paper. I get it, I mark myself, and then I do another work. So I thank Mr. Robert Kaushenga for loving us. We love you as children and continue loving us. Also, I was facing some challenges while I was using that newspaper. My parents were not able to buy every newspaper because also their pockets were locked down. So they weren't able to buy every newspaper, but I thank them for what they bought whenever they could afford. And then my school, Nachivo Primary School, it did great work to see that I continue learning during the COVID-19. My head teacher, Mrs. Mugisha Agnes, all the teachers, Teacher Fortunate, Teacher Bonza Davis, Teacher Alex, and more, they could call our parents to go and pick the work for us. We were doing that work during that short time. It It was keeping me busy and was giving me hope that we are soon going back to school, though it wasn't easy. That's how I continued learning during my COVID-19 pandemic.
Wow,
Thank you.
Thank you very much, Belly. It is quite an energizing experience. She tells us exactly what she is, and I liked her with itness. She could really imagine where she came from. From the 18th, she told us the story. 20th, when they locked, she said, we are going to be at home for a week. Hooray, we are staying home for a week. The week turned into months, and the months were eventually rolling into a year. But we thank God, we are soon getting there. We thank the Ministry of Education for the phased reopening of schools. At least the candidates are back to school. It gives them more hope. Thank you very much. I noted that the children became teachers. They had to teach themselves and mark themselves. So that is another way of reimagining. You remember what Shadrach talked about? That is the way to go. Reimagining. Dr. Lusambu talked about reimagining a class without the four walls. And that is where we had to be. Thank you very much, my daughter. You have really given us good experience, and I hope those out there also had the experiences in the same way. Ladies and gentlemen, allow me now to invite Rosemary from UNICEF. Rosemary, UNICEF has really made this happen, and we are really proud. We are so much proud that we are celebrating this World Children's Day together, but anchored and spearheaded by UNICEF. Thank you, Shadrach. Thank you, UNICEF. Thank you, Provia, and everybody that has made this one happen. We are very, very grateful. Now, Rosemary, as UNICEF's contribution towards ensuring children continue learning in the pandemic, what have you done? We are here today, we are seeing this day. Has UNICEF been doing something to ensure that the children out there continue learning? What is your side of the story?
Thank you very much, Abed. And good morning to you all again. UNICEF Uganda has been working very closely with the government of Uganda to ensure that we contain the spread and support the efforts being made to manage the COVID-19 situation through various programs to support child health and nutrition, water and sanitation programs, education programs, as well as child protection and social protection programs. All in all, UNICEF, as one of the many partners who have worked with the government of Uganda, have worked to ensure that in the period since March this year, we have worked to support learning efforts by the Ministry of Education. UNICEF is one of many education development partners in this country who are both bilateral and multilateral agencies, and UNICEF is also a member of the local education group that comprises of the Ministry of Education and Sports, education development partners, as well as civil society organizations. So we've joined hands, and through the support of UNICEF as the coordinator of the Global Partnership for Education in Uganda, we worked first and foremost to support the ministry's efforts in developing the Ministry of Education and Sports COVID-19 response plan, which was very good in terms of securing additional resources for the sector to be able to respond to the COVID-19 pandemic. This earned support from the GPE that has now looked at enabling the government have materials provided for learners, both home learning materials as well as radio programs that not only sensitize the parents and the communities on the effects of COVID-19, but have also, working in collaboration with the Ministry of Health and Ministry of Local Government, been able to register the teachers who have come back to support learning through home learning community-based centers. So with the provision of these home learning materials, with the radio programs that have recorded lessons that our young sister here has referred to, children were able during the pandemic to receive these lessons, both on television and radio for those who had access but also through digital online platforms, such as the one called Colibri, that has digital content in maths and science for secondary school learners. So there were quite a lot of efforts by different partners, including UNICEF, to ensure that materials were being provided to the children while they were at home, and that continuity of learning could take place. And we especially as UNICEF recognize and appreciate the generous support of the governments of Ireland, of Norway, of Denmark, and the Global Partnership on Education for really supporting a lot of the efforts that were made to print these home learning materials. With thanks to the New Vision company, we were as well able to ensure that these materials were printed very fast and also delivered all across the country. In addition to that, UNICEF has also supported the Ministry of Education to develop school water sanitation guidelines. So the school wash guidelines are now out, and these were very useful as schools were reopening. And we also want to join our voices to thank the government of Uganda for having reopened schools for the candidate classes. And through our various levels of advocacy, through the development of the plans, through mobilizing support of many partners, we were able to ensure that these materials reached quite a number of children. And we are very grateful that the National Curriculum Development Center was able to really work very hard to develop the materials. Also, they developed materials in local languages that were also supported through UNICEF. And they also are now finalizing the Braille materials for those children that have low vision. So we're adding to those efforts of government really to ensure that one, the materials are available, and two, that they reach the children wherever they are. So we will be very grateful to have more partners join this effort, because indeed we must reach the very last child in all the efforts we are putting together. So I just want to say that among the different efforts at both national and district level, we've worked very closely with all the local governments. The local governments have themselves been able to ensure that teachers are registered and return to school. And I would like to say there's one good practice of home learning that has been very well implemented in regions like Karamoja region, like West Nile region, Western Uganda, and Central and Eastern Uganda as well. So there's quite a lot of efforts behind the scenes that we are working very closely with the district local governments to ensure that children can gather in small groups to be able to also observe the SOPs to learn in clusters with their own teachers. And this has helped also bridge that gap where kids may not be able to learn on their own at home, but can join with a few others and be able to learn. So for all those efforts, we just want to return the thanks to our partners and also the government for this enabling environment that has helped us to carry on, even in these circumstances, to deliver learning to children across the country. Thank you.
Thank you very much for coordinating that. We have really benefited a lot as ministry from UNICEF. And one notable one is the formation of the COVID Education Response Plan. This one has borne more fruits, and it is going to stay with us even after COVID. Ladies and gentlemen, I want to take you into a video where UNICEF has done some good works, where they have really showcased learning during COVID. We have had children, even in the camps, get this education system. The papers that we are talking about have been circulated, and everybody out there has been benefiting. These children have put them to use. Bella's told us, when the children have chance to access these materials, they will always be there. I want us to have that video reflecting on how the children have learned and what has been done during COVID. Thank you.
My name is Nanjo Zaya Catherine. I'm in primary 7 at Shualera Ame Primary School. In Corona, I've been using the radio. I listen to a math lesson, science lessons, English. Grandma sometimes, if she has money, used to buy for me the newspapers. I read them with my young sister. At our school here, the UNICEF gave us the movie station, computers, loudspeakers. I get time to come here after doing my work at home. We use the mobile station to access the information on Colibri, and Colibri is a program uploaded with the digital lessons. You select what you want and you can hear and see. So me, I select audiovisual because the class is inclusive. And I like coming to this mobile station because when I use the mobile station, it does not require internet. We learn English, read stories, because if I learn English, I can even get better marks in every subject. The advantages of using that mobile station is that the notes can be revisited. Even we can learn without the teacher. I want them to add small devices because 75 children, they use one mobile station, and even the rooms are few. When I grow up, I want to be a lawyer. I want also to sit in those big offices. They drive me and they can take me to judge the suspect.
Thank you very much for that video. It really reflected on what has been happening. The children have spoken and they have talked. At this moment, let me invite now Mr. Chisirinya Francis, the Deputy Director of the Private Sector Foundation, to tell us their contribution as private sector towards the creating and implementing of solutions to improve access to learning in Uganda beyond COVID. They said COVID is here to stay. Francis?
Thank you very much, Mr. Moderator, and good morning, our viewers this morning. First of all, I would like to speak as a member of the Private Sector Foundation in Uganda, a parent, but also a member of a school board. And my presentation will touch the issues that we are grappling with in this era of COVID and how we are responding as the private sector. First of all, in context, we have already talked about this, but you know very well that 99% of the children are not learning today because the traditional school was actually closed because of COVID. But thank God, what the private sector has done in collaboration with the government, in collaboration with the development partners, to create an environment for learning, as UNICEF and the Ministry of Education has already told us, is extremely wonderful. We know for sure that many children are again learning, despite them not being in classes, apart from the small group in the candidate classes. The private sector in general has worked tirelessly to innovate and bring solutions that can allow our children to learn. I would like to thank the edutechs, the education technology companies, for creating applications that are being used for learning. I know very many children who actually connect over internet to learn. I also know that there are several other schools as well that are actually helping their children to learn through creating materials for them to work and study at home. So the Private Sector Foundation has seen a lot of interest in trying to help the children to learn while at home. Having said that, we can see that we can do more. And in fact, as we have already known, education and delivering learning might not be the same again. As the Commissioner put it, it is very clear that they will be learning without classrooms. They will be learning without the four walls. Now, this learning is going to be driven mainly online. and the online applications consume data, they consume bandwidth. As PSFU, we are working with our members to work on an advocacy position that can help our government to try to reduce the cost of bandwidth in the country. It is very clear that the bandwidth in the country in Uganda costs much more than it is in other countries. So we would like to work on advocacy that can really help us deal with the issues of access of bandwidth. In relation to that also, we know very well that it will be good for us to move our education online, but we have very many challenges within the country that are creating or that are leaving out many children without learning. There are many places where the access to devices, even if it is a radio, is difficult, and I think that is why the government thought about buying radios for the children. We know very well that cost of devices to be used, like the smartphones or simple phones that can be used, is quite expensive. Now, we need to work on a situation where these costs can come down so that we can have equity in education. Let us not imagine that when children of people in the cities, in the urban centers are learning, every child is learning. That's not true. So many children in the rural areas are not learning. So we need to innovate. We need to support innovation that can create solutions to create equity in the learning environment. Now, as PSFU, in partnership with our development partners, most especially the MasterCard Foundation, we have created a program that helps our business community to respond to the challenges of COVID. And one area that is of most importance to this is we have created a program that can help the education service providers, that can help the business community in finding what we call alternative routes to the market. If you really to meet your children in a classroom and now you cannot meet them, how else can you reach them? So you have to reach them using digital systems or radios. So we are happy to support organizations to create alternative access to markets. The organizations can create their own applications. The small ones can use applications that are already available, and then we help them to subscribe to those systems so that their children can learn. Also, we know very well that all these devices, radios, smartphones, or simple phones, work using electricity. We also have got a program which we are running with the GIZ to help extend solar systems to rural areas, what we call the last mile. There are so many places in this country which don't have access to a grid. And also, there are areas where the solar companies are not willing to go because it is not profitable at all. So what we are doing with the GIZ is to help companies reach these areas with solar systems so that children can be in a position to access systems. So this is what we are doing as private sector foundation, but clearly it is very, very, very important, and we'd like to continue contributing on how development of the curriculum is going to be in the country, redevelopment and reimagining, because as you know, and as the commissioner put it very clearly, for the in the future, a child has got to teach themselves. So they have to have the 21st century skills. We are happy to be able to play a role in this, and thank you very much.
Thank you very much, Francis. Thank you very much for the innovations. We like the advancement in subsidies towards the solar, you call it bandwidth? It is the limiting factor if learning is really take place. And then the solar panel. Thank you very much. You have really hinted on what is supposed to be done, and we are grateful. At this moment in time, I want to invite another child, and this child is none other than Shamil. Shamil, we are soon going back to school. Of course, For some classes, the candidate classes, the P7s are already back to school. Senior 4 is back to school. Senior 6 is back to school. And other institutions that have got candidate classes have gone back to school. What are your fears? What are your expectations as we go back to school? As a child, what do you think should be done? Or what do you think is being done well for education to continue?
Thank you very much for giving me this chance. My name is Muchibi Shamira Heija from Kamocha in Church Area Zone. I'm a student at Kolo Senior Secondary School and a boy champion of Trailblazers Mentoring Foundation. I'm in S1 and I take this chance to thank UNICEF, TMF, UBC and the Ministry of Education for giving me this chance to share with you my fears and expectations as we celebrate the World Children's Day with the theme Reimagining the Future of Learning. My first fear is that I myself might get sick of COVID-19 because the medicine and vaccine hasn't yet been founded. And yet we are many in our school and it does not support the social distancing. My other fear is that I might not get chance to see other students coming back to school because I expect that some of them got married, others got pregnant. For example, when we went for a ceremony in Gomba, I saw a girl of 16 years old married. My other fear is that some teachers might lose interest in teaching because during the COVID-19, they join other jobs that bring in more income more than teaching. My last fear is that I might not get promoted to another class and it will affect my studies. Then I'll go to the expectations. I expect the school to add more washing facilities and I expect them to be refilled every after the water is used up. I also expect the school to be disinfected regularly. I expect the Ministry of Education and Sports to cooperate with the Mukwano to give out soap to every school in Uganda. I expect schools to put the law in work for pregnant girls to go back to school to study. Thank you.
Thank you very much, Shamel. He has his fears. And of course, these are the fears that every child has in the country. They fear to catch COVID. They have been at home enjoying with their siblings and none has been sick. So you want them to go back to school and they catch the disease? That is a very, very big fear. They also say they fear for the other girls who are pregnant and the teachers who may lose interest and the fear for not being promoted. That is also another $1 million question. Children are used to going to the next class every December. Now here we are approaching December. They have not done the examinations too. But as we said, your rights and responsibilities. You expect the school to provide washing facilities, but it is also your responsibility to use them reservedly. Then they are saying schools should be disinfected. Yes, of course. Partnership with others to provide hand washing facilities. Of course, these are the children's fears. We shall open up, but before we go there, I have Mr. Okello, the director, Mr. Okello, Dr. Okello, Ian Daniel, Kampala State Authority. Now you have had the children talk. How can schools operate without compromising both the health and safety conditions for the children and teachers? They have talked, they have got their fears, and they have got the expectations. You are coming from the health perspective. What do you think we should do to address those fears and expectations?
Thank you, Hamid, for that, and thank you, Shamil, for bringing out your fears. And one, I would start by saying that schools are unique. Schools are workplaces for the teachers, they are workplaces for the support staff, but schools are also points of learning. Schools are also areas where there is congregation. People come from different places. They come with what we call unknown risk profile. When schools opened about 6 weeks ago, we did not test every child to be able to know whether a child had COVID or no. So where we are now is pointing towards how can you be able to prevent, but how can you also be able to mitigate. Just to catch on Shamil's fears, the first was he expects schools to be disinfected. And I usually tell people that the first person to be disinfected is the individual. When we are telling you to wash your hands, when we are telling you to sanitize, when we are telling you to put on a mask, we are indirectly telling you that can you disinfect yourself? Because once you disinfect yourself, then the chances of you passing on COVID become less. And when 1, 2, 3 and you create a bundle do the same thing, then we reduce the overall chances of everybody getting COVID. So when you look at the school setting, school settings, the beauty is that school settings seem to be equipped through their systems to set this in place. When I joined school, secondary school in S1, one of the things I was given was the rule book. And they would take you through a rule book, what is supposed to be done, what is not supposed to be done. COVID has brought what we call SOPs. In a layman's language, an SOP is a rule book. It is the things of do's and don'ts. And in a school, that is already there in the system. We know you wake up at a specific time when the bell goes off. You're supposed to have assembly. There are certain ways in which a school is structured to operate in such a way. So the SOPs are building onto what we already have in schools. So again, what we should be able to do as schools is the Ministry of Education, in collaboration with the Ministry of Health, came up with a rule book for prevention of COVID. Now what we have to do as schools is have those do's and don'ts and let us stick to them. The challenge is when we don't stick to them is where you'll find that there are issues of COVID. But it just takes one person not to stick to them. It may not be a learner, may be a teacher, may actually be a supplier. So that's the first thing that we should do to make sure that the schools are safe. The other is, we all know that you may have all the rules, but enforcing them can be a challenge. And what we usually say is, let's be each other's keeper. From the public health perspective, rules are best kept when each of us are looking at each other, rather than having somebody overhead looking at you. So for Shamil here, when you're in school and you see your friend not putting on a mask, remind him that put on a mask. When he hasn't washed his hands, remind him that he has to be able to put on his mask. And this goes all the way from the teachers to the students. And again, I said schools are equipped for this. We have everybody from a head boy to the different prefects. I know there is a prefect who is usually in charge of health. We have the class monitors. And when you are having a discussion at the scientific committee from the Ministry of Health, we also suggested the idea of having a cough monitor. And a cough monitor could be a student who's within fellow students and is supposed to look out, is this child coughing? Does somebody have a flu? Because this used to be there in other ways. They would call us for assembly, check for our nails overgrown. And what this does is that every morning, if we are to look out for each other, who has a temperature, who has a flu, who has a cough. And the essence of this is that can you identify the first person who has signs and symptoms such that they don't transmit to everybody else. Now that is what we'll call looking out for each other. And that is being each other's keeper. COVID has been with us since December. That's about 11 months now. I don't think anybody in the medical profession was taught about COVID-19, at least the doctors who graduated until this time. It is something we got to know as we were practicing. So because information keeps on coming on a daily basis, it's also important that us in schools, let's give as much information as possible to the students who may have, because the students here, one of their fears could be due to lack of information. So let's have an avenue where information can be shared with the students. Let's have an avenue where information can be shared with the parents. That is critical. Never tire to give information, because once you give information, then the problem that you have, a solution can then be gotten from more than one person. The other from schools, let us have a, I usually call it a multi-team unit to be able, I know the Ministry of Education has a response plan, such that every school should be able to have a collection of people of different skills, such that they can be the response team for COVID. And why you have this team, one of the things this team should do, and again I'll borrow from what Shadrach said, is what if. And the what if helps you with scenario planning. When you think about something and it happens, you have the advantage that you thought about it. So the scenario planning, which I encourage all schools to do, is what if we get a child who is COVID positive? What if we have 5 children who are positive with COVID? What are we going to do at the school? Who is going to be in charge of communicating? Who is going to be in charge of linking with the health workers? Who is going to be in charge of linking with the teachers? What if a teacher has COVID-19? So with all this scenario planning, and this team should be able to link up with the district teams, the district task forces, such that if this happen, you have all the resources to be able to support you. Because we have diffuse community transmission, we know that some students some learners who have come back to school may have had an experience of COVID among their families. A father may have gotten COVID, a mother may have gotten COVID, any of their parents may have gotten COVID. So again, I would know that when they do come back to school, we need to take care of the psychosocial component. So schools should be able to prepare themselves for that. A few schools have already reported cases of COVID, and we have been learning from that experience. And one of the things we have learned is that psychosocial care is critical, because if I say my best friend has COVID and is evacuated away, there is an effect on the children. One of the effects we have seen is that they tend to hide away. They do not want to report that so-and-so has signs and symptoms. So all this can be done by having avenues of communication. And once those avenues are clear and the students realize that this is being done for their own good, then those fears will be able to come down. And scenario planning will help, because if I have a flu, they will know, go to the school nurse. If this happens, these are the steps that are going to follow, and they're all done for our good. So just to, again, take it through and summarize, is that when we shut down on 20th of March, as you said, people thought it was days or weeks. And the advice, let's plan for the long haul. There is no harm in planning long term, because if the vaccines do come in time, you have the advantages that you have planned for the long haul. So let's plan for the long haul. It is, we are happy that there is some light at the end of the tunnel. They are promising vaccines that are coming on board. But when and how they do reach to Uganda does not mean that we should be able to relax. COVID is still there, and we need to absolutely take care of ourselves. Thank you very much.
Thank you very much, Dr. Kello. Thank you very, very much. You have really talked from the medical profession and point of view. I've noted that we need to plan for a long term. Many people look at the short term. The $1 million question has always been, is this thing ending? We're always talking about beginning the school calendar year 2021. Are we sure schools will be safe? So this is what is happening, but thank you very much for sharing with us. I've noted that we need to have a multi-team unit. Let everybody be responsive to the other. Let everybody understand that is responsible for the other person's challenges. And then the other one is the psychosocial support. Now, Dr. Lusambu, getting back to you in just a minute or two. You have heard the doctor talk about these issues. What is the government going to do differently for the education sector beyond COVID? You have heard the doctor, we need to plan for the long term. What have you planned as education? Thank you.
Yeah, thank you very much, Abe. I one day attended a debate about 2 weeks ago, and this debate was again concerning COVID. And the school had the topic that what do you think of the two factors that will be the best in fighting COVID? Is it the social factor or the scientific factor? At first I thought this was a very simple solution, scientific. But when the students started debating, actually it was at Katende, that school at Katende down there. It was a very interesting discussion. But after listening to Dr. Pello, I also agree that it is not only the scientific factor that will help us sort out COVID. The social factor is equally very, very. Listen to the radio, and you have a duty to buy the cells in the radio. You also have a duty to control yourself from sending this child to the garden, but telling this child to listen to the radio.
Thank you very much, Dr. Lusambu. Thank you very much for the commitment and the focus that we have. Rosemary, you have heard Dr. Lusambu, and he's calling to, for the partners to come and really support this, but also most importantly, the other stakeholders. What do you think needs to be done as partners? How do you look at this? You have already told us you have circulated the materials, you have supported the education response plan, but now you have listened to the children themselves. But you have also heard the doctors say what is supposed to be done. What does this tickle you to think as partners?
Thank you very much, Abe. Really reflecting on what all the panelists have said, I agree entirely that we have to start reimagining the future of learning, and it starts now. And what a better time than on the occasion of the World Children's Day 2020. Let's make this a turning point in all our efforts to support the Ministry of Education and Sports to ensure a future for children where they will be able to learn, and also ask ourselves that what if question. What if we had the resources to ensure that we can bridge that digital divide? What if we work even closer with more partners like our private sector foundation and all the membership there? What if we had a situation where our most important and critical partner, the parent, also steps in to reimagine a world for their child, of a future for their own children? And at this point, really, I think we really want to thank all parents all across the country. They have been our #1 partner. They have used their resources to ensure that their children were able to learn during this period, for the majority of them. Even at areas where we've worked with the district local governments, we've seen parents encouraging their children to get the materials and be able to follow up on a one-on-one with their teachers. So with the parents' support, we know we'll start a whole revolution of reimagining a learning for the children in their future. And as Shadrach just said, let's prepare ourselves to move from a period of learning to earning for the children. So let's make the future more bright and more promising for them all. Thank you.
Thank you very much, Rosemary. Thank you very much. The what if question. I like Dr. Kello's question. What if? What if we are after here and they say Dr. Lusambu Abe has got it? Then what do you imagine as the people that have been close to him? How do we look at that? Thank you very much, Doctor. But now I'm going back to the children. You have heard the parents, you have heard the commissioner, you have heard from the health department. Now, as Bella, I'm getting back to you first. What do you want to be done beyond what has been said? What do you think your mother, your teacher, your other person you're staying with in the village should do to make sure that you are safe for learning? You can come here.
Thank you very much. According to me, I think the government should, because not every child is studying. Some of them, they are doing their own work at home. They are no longer focused on books. So according to me, I'm suggesting that the government should let every child report back to school. But there is this pandemic. I was saying that they could provide like shift lessons. Like they say P1s, they come in the morning, then they go back in the afternoon, and let another class come. So at the time they come, maybe each class comes twice a week. As they come, they go back home with work, which will keep them busy. Because some of them, they are not focused on books. And their parents, they go in the morning, they come back in the evening. They don't know whether their children have been studying. So if the government can let every child where he or she is to report back, but in shifts, so that we continue learning. And another thing, the government had tried to give us reading materials, like the newspapers. They helped us, but some of us we did not get because the papers were given through the LCs, but some families we did not get, like me I did not get. But if the government is to provide reading materials, I'm suggesting that they could give out through schools, because each school, it makes sure that every child where he or she is and he belongs in that school, he gets that reading materials. And another thing, I am encouraging the parents who are still there with the children, lower classes and upper classes, senior ones and senior twos, to encourage the children to get their books and revise instead of taking them to businesses to work. Some of them are now they are on the road selling things. Some of them are digging. So that's child labor, and that's not their right. So parents are focused that we have to get money, what if you go back to school? But every child, according to me, if you just get a chance of getting money, no more school. You're done. Thank you very much.
Thank you very, very much, Belly. You know, the children have spoken. You have heard. They have advised, let's have shifts. Doctor, you have thought about that? Yeah. Let's have shifts. And they're saying it. A child can come today, then the others can come in the afternoon. Instead of keeping them, these pregnancy cases, I'm sure, will go down if we have the children back to school. She has also talked about the distribution of self-study materials. I'm happy you have noted this, but NCDC and the ministry have also done something towards that. I am sure your question will be addressed. Then the other challenge of child labor. Child labor. The children can work and learn from the parents, but they should not be exploited to the extent of being involved to sell and only depend on that because they are supposed to survive. Muchibi, what is your contribution in this direction? Another child, other ideas. You have heard the children and they are really telling us what we should do. Yes.
Thank you. I would suggest the Ministry of Education and Sports, if it's to give out radios, to give out solar radios, because in most parts of Uganda there is no electricity, and a grandmother in Karamoja is not going to buy dry cells every week when she doesn't even have money to buy food. Then my other suggestion is for the government of Uganda or other stakeholders to put computer hubs in every part of Uganda which can be accessed by every child, with people to help those children who can't use the computers, for children to research for more work. Thank you very much.
Thank you very much. Thank you very much, Muchibi. Francis, you have heard the child talking about the computer hubs. You talked about this. How fast or what plans can we have to ensure that at least these children can access the information? He talked about the radios, but he has also hinted about the hubs. What do we think we can do in the short term to ensure that learning continues?
Sorry. Yeah, thanks very much, sir. I think importantly, as we've actually mentioned, is we need to work very quickly to see to it that the cost of devices, the cost of equipment, together with the bandwidth comes down. This is very, 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 very important to create these hubs, these new approaches and new models to support education in this current COVID time and beyond. Besides, we also need to work on a number of innovations that will help the current education service providers, especially the private ones, to overcome the challenges they have actually faced because of COVID, and then be in a position to invest in new ways of delivering education. I would also like to propose that we should look at some packages of incentives to the people who are doing and extending education in the rural areas. It is so critical. It is not possible for the country to focus and say we're okay by only looking at those who can access education now. Those who can access it in towns, in urban centers, and also the well-to-do. We do have so many children in the rural areas that are not studying, just like the young person has actually put it. How do we create opportunities and realistic opportunities for them so that they continue getting quality education that will take them to the next level? What about the teachers? I'm a teacher. I'm used to my chalkboard. I'm very good with my chalk, but things have evolved. It is now about a notepad. It's now about a whiteboard. We need to reskill the teachers so that they are more savvy in technology. They are able to deliver to the children, support them to learn in a digital environment. These are things that I think we should focus on and do fairly quickly to support and ensure that our education system continues to support our children going forward. Thank you.
Thank you very much, Francis. I want to get to Dr. Kello briefly. Doctor, the teachers are back. The children are back in schools, and you have also told us that there have been some cases noted of COVID. What have we got in plan to have the teachers and the school children sensitized to reduce on the stigma? Because, like you said, one of them is whisked away with the COVID pandemic, and then the others will run away from school. Do we have some packs? The masks have been given out to schools. We are very grateful for this. But do the children know how to utilize them? What can we do to make sure that everybody in schools is compliant and ready to protect the children?
Okay, what the ministry has done and what the government of Uganda has done, I think about 3 weeks ago, they launched the community engagement strategy. And the community engagement strategy broadly was to move the COVID response away from government being at the center to the community being at the center. And what we have done is, for the case of Kampala, is to train what we are calling COVID coordinators in every school. So we told schools to pick one teacher, and they picked a teacher, and we trained quite a number. And one of their terms of references, apart from being able to look out, to do surveillance, as we say, or to look out for anybody with signs and symptoms, was to do what we call risk communication, educate the students on how they should be able to put on masks, when they should be able to put on, and the do's and the don'ts. So that we have done. The other, as we are saying, is, you know, school is also a workplace. So we have also, I know with the Private Sector Foundation, with Federation of Uganda Employers, we have put what we have called workplace SOPs and been able again to engage people in the workplace on how they have to be able to behave. So as I was saying, that it is something that, as we say, started from the planning phase. And bringing out the candidate classes was deliberate. If you notice that they constitute, I think Dr. Osambu can tell me, about 1.5 to 2 million. Yeah, so that's slightly about less than 10% of the students. Now that is supposed to create room to make sure that it's a place safe. And why we are doing that is what can we be able to handle safely? And as the vaccine and other measures come in place, then all the others can be able to come into school. So from the planning phase, we are looking at safety, and later on we are learning such that when and how the others come into school, we are able to manage them safely, and also such that also the schooling environment is safe for everybody else. Thank you.
Thank you very much, Doctor. Thank you very, very much. As we now go into getting questions and other contributions from the listeners and the people in the gallery, I want, in 1 minute, Dr. Lusambo, what lessons have you learned from the current situation? The children have gone back. The candidate class has been at school for over a month now, and we are in preparation to have the other classes also get back to school. What lessons have we learned, and how good is it helping us to prepare?
Actually, you have come to the real issue. Why we decided to reopen in a phased manner was to learn lessons. And I'm happy to report that we have learned quite a number of lessons. First and foremost, we have learned that it is possible to enforce the SOPs. Most of our schools have been able to enforce the SOPs. Secondly, the dissemination has been greater because schools are a center of learning, and teachers and learners are agents of change. So the public has got more awareness since we reopened the schools. Thirdly, the learners have come to appreciate that that COVID is real. And with COVID being real and dangerous and no vaccine yet, every learner has been put on the alert to ensure that they keep one another safe. So you find them really counseling each other, advising each other, reminding each other to put on their masks and so on. So there is a culture that has already started to develop in schools. And with this culture, we have a lot of confidence that what the learner has requested for, what my daughter has requested for to reopen in schools for all learners, because they feel safer in school and they can learn in shifts. I think this can be done according to the lessons so far we have learned. Everybody, every stakeholder has been more aware of the COVID-19. And I think this is something in the very correct direction. Our achievement is likely to be met because the objective was to learn lessons that would help us open to another phase or a general one. And I think it has been achieved.
Thank you very much, Doctor. I wanted them to hear from you. Now we are opening up. If you have a contribution towards this, if you have some issue, we have got a mix in the gallery and people who are listening in. If you have an issue, but as those issues keep coming, I wanted to get back to Rosemary. The children have talked about, we talked about the education response plan and how it is helping. Does it have a provision of addressing the technology part of it? Because we have printed the materials. But do we have also that direction of taking learning to them? We have the radios, fine. But do we have any other thing defined in terms of going technology now?
Okay. Thank you very much, Abe. And in reimagining future for learning, we would like to give children's voices more exposure. We would like to amplify the voices of these children who have clearly told us today what really needs to be done. And it's really to bridge that digital divide. Shamil gave us a good example of setting up those computer hubs. That is possible. That can be done. Similarly, Nelly gave us an example of the double shift, really. That's what she was referring to, where we have some children learn at certain times so that we can move them from home back to school. And here we'd also like to commend the government of Uganda for having reopened schools and being one of those countries in the region that have done so. So it's a good start, and like Dr. Lusambo has said, we've learned lessons. The Ministry of Education is developing the digital agenda strategy. that's the direction to go in. And that's where we also will partner with other partners. The civil society organizations have been extremely helpful through the different working groups, the home learning materials working groups, the radio working group, the digital agenda and online platform working group. They've done a lot, and more partners at this point can come in. And going back to what I also said earlier, and the parents also join us in this whole change. Let us see this as actually an opportunity, in that now we have to build back better and ensure that while the pandemic may still be going on for we don't know how long, but while it's still going on, let's see how to make this situation much more easier for the children to learn and to eventually move on. He had a fear of what will happen to children if they don't go back to school. How do we then support the children to ensure that they are being listened to and their views matter? Thank you very much.
Thank you very much, Rosemary. I want to invite Birungi Musa here. Birungi is in charge of the water, sanitation and hygiene in schools. And UNICEF has supported us in quite a number of districts that have benefited from the hand washing. What you are in monitoring with the other ministry officials, what is the situation on ground in utilization and management of what we have received already? The hand washing facilities, are they put in use? Have the teachers neglected them? Because the children are here, they are saying we need to be provided. We want you to come and tell them and tell us how the use is out there in the schools. Musa? Yeah, thank you. We shall be welcoming and accepting more contributions the way they come. Please, we have that time for you, and then we eventually close it.
Thank you very much, Haj Abe, and the panelists, together with my fellow viewers. Water sanitation and hygiene in schools is very critical in ensuring that our learners can study in a very good environment, and we enable them to study very well. Recently, UNICEF donated water supplies. At first, they donated to 444 primary schools in Karamoja, West Nile, and some few local governments in Busoga sub-region, that was Iganga and Mayingo. Just last week, UNICEF added more supplies to 301 schools from all the refugee districts. That is about, those were about 13 schools, and then Karamoja, West Nile, an additional 10 in Iganga. Right now, schools have adopted and they're using the SOPs. Actually, Dr. Kero, our schools have greatly improved in as far as SOPs are concerned. Learners kill the hand washing with soap. They observe social distance. Teachers are still actually advising, guiding, and coaching our learners how to avoid COVID, but leaning on the SOPs. Of course, we've got some challenges in as far as implementing WASH is concerned. Some schools don't have enough funds to support them procure the recommended water supplies. We have some challenges, but we are guiding them to use the community engagement, support our schools out there to buy these items. But on the positive side, using the grant from World Bank, all schools in the country received some money to kickstart the process of buying the water supplies Each school, I think, was advanced like to a total of 1.5 million shillings countrywide, and they have greatly used that money to procure some supplies. So we call especially the parents, to support this agenda. We want to see our schools having the recommended wash supplies to ensure that we hand wash effectively in our schools.
Thank you very much. Thank you very much, Mr. Birungi Musa, for that on-ground explanation of what is happening. Ladies and gentlemen, it has been a long morning. We started with sharing experiences. You remember what Shadrach told us, and shared the general picture worldwide. And it was really touching, because everybody, and in the country here, we all saw where we're coming from, but it helped us to reimagine where we're going. You have heard the panelists. The children have spoken. They have told us what we need to do, but they've also shared their fears. So as we plan to reopen schools, as we plan to protect the children in the near future, we need to really do the basics they have talked about. We also need to help them reimagine learning. We need to see learning take place. We want to go the way Shadrach talked about it. We don't want to say we are not doing anything. And we don't only want to live in the world of hope. Let's reimagine. Everybody has a role to play. Each of us can do something where we are, and this one can touch lives of different people. I want to thank UNICEF. I want to thank UNICEF so much for making this happen, and the other partners that have supported this intervention to take place. We also appreciate the UBC group for enabling us to really have this. We were supposed to be here on 20th, but we are here today, and the children have listened. I want to appreciate our colleagues from the Private Sector Foundation. Thank you very much. The struggle continues. We need to fight and make sure that we uphold what has been talked about. Dr. Kello, thank you very much. Ministry of Health is leading. These partnerships are key. We need to build synergies now. Nobody is supposed to work in isolation. The children do not belong to education alone, neither do they belong to health. We all have a role to play. So thank you very much for bringing the light and helping the children to understand. Dr. Lusambu and the whole education department team that have been here, we thank you very much. We have really listened, and we have shared with you, and the children have spoken. Ladies and gentlemen, we now go and implement. We now go back and send the message to the many children that are still out there that the schools are safe and ready for reopening. We have a living example. Bella is at school, and she's kicking well. She's live and kicking. So there is safety in schools. We thank you very much for having been here. Thank you very much for creating time. We are looking forward to cascading these debates to the local government level. Let's not stop it at national level. We have the local governments. We can go regional. Send the message. Let these children go and talk to the fellow children. Maybe the message will sink more. Let's use the health practitioners and the public service private sector foundation to go and roll out. Whoever gets platform, let's talk about the safety of the children, and I am sure it will go a wrong way in happening. Proskovia and the team, thank you very much. We are glad we have had you. Thank you very much, ladies and gentlemen. I want to wish you a blessed week, because we are starting, but also a blessed month that ends this COVID year, and a new opening into the next year as we conclude the Christmas and plan for reopening. God bless you all.
Thank you.